We had been doing a lot of work with patient experience. I had done it for a couple years in the hospital. And one thing that kept coming up that the students kept talking about is access to healthcare from other populations. The students looked around the community and they saw that there were a vast number of resources, but the problem was that the individuals in the community just had no access to them, or they didn't know about them.
So Connect2Health is a volunteer program born out of a praxis lab, and the volunteers work at 4 different kind of medical clinics, and they help connect patients to existing community resources. So I like to think of it in terms of we help connect patients to things that help them with their health status, but are not necessarily a part of their health care. So things like food, clothing, shelter, some of the more basic things that your doctor can't necessarily give you a prescription for, we write a resource prescription to help get those patients connected.
Right now, there's about 15 to 20 Connect2Health students. They come in and they work in the waiting room and work with folks right there on site, which is a really great place for them to be.
And we have this binder here that is full of resources. So every resource you can imagine in the Salt Lake Valley: food, clothing, housing, cell phones, domestic abuse, I mean all kinds of different resources that are available that we have put together in essentially this database.
Folks that are homeless feel like they're invisible. And immediately when they come into the clinic, they are greeted with a Connect2Health student. And they become human and somebody that just wants to help them. They don't necessarily have the resources to make the phone calls, to get the dentures, to get the shelter, to get the bus fare. So just treating them as human beings is truly the biggest thing we can have these folks do.
You know, students just want to do amazing stuff. And the more that we as instructors and in the praxis labs can get them out of the building and really working with the community with impactful solutions, the better.
So to the donors and the Praxis Lab programs, I would say thank you so much. It's been really influential in my career path. I mean, working with Jim in the original Praxis Lab is what led me. I got an internship working at Kaiser Permanente in Oakland, California. To have the opportunity now to work on a real life program where I'm directing 50 volunteers. I mean, it's just crazy to think that this program was born out of a class. Like, it was a project, and it's all of a sudden this real world thing where we work with patients and help connect them to the resources they need every day.